Good afternoon all, and it is my great pleasure to welcome you all here today to Summer Foundation's 10th Annual Public Forum. My name is Paul Conroy and I'm Chairman of the Summer Foundation Board. Due to the continuing challenges of COVID-19, this year's forum is being held virtually from a studio here in Melbourne. The upside of this format, of course, is it makes it much easier for everyone else to participate from wherever they are. I wish to acknowledge the traditional owners of the land on which our forum is being broadcast today. Where we are here is very close to the meeting of the lands of the Bunurong and the Wurundjeri people of the Kulin Nation. I pay my respect to their elders, past and present, and to the Aboriginal elders of the many lands upon which we are collectively gathered today. Our theme for this year's forum is reaching towards success, closing the door to aged care for younger people. Today, we will look forward to hearing on what has been done and what still remains to be done to successfully resolve the issue of younger people with disabilities being forced to live in aged care. Our forum host today is Beverly O'Connor, and 3 of our speakers have been able to meet us here in the studio, while another 6 speakers will be joining us remotely. Of course, a lively discussion can raise as many questions as it does answers. So we have assembled a team of experts from the Department of Health, the National Disability Insurance Agency, the Department of Social Services and the Summer Foundation to help answer your questions. Please submit any questions you may have via the Zoom Q&A function during the course of the forum. We'll keep taking questions up till around 1 p.m. At 1:20 p.m, the Q&A session will commence, whereupon your questions will be answered. Any questions that are not able to be addressed during the session will be answered following the event via the Q&A resource that will be published on Summer Foundation's Annual Public Forum webpage. A link to this document will also be circulated to attendees after the event. At that note, I would like to hand it over to Beverly O'Connor to host the event. Thank you.
Paul, thank you so very much, and really, once again, an enormous privilege to be with the Summer Foundation and with all of you today. Even if it is remotely, we can't see you, but we know you are with us on this very important discussion, of course, the pathway to a resolution of young people living in aged care. Such a critical one, and one that the federal government now has firmly on the agenda. What a perfect way to start than with Pauline, who's just the most delightful young woman who lived in aged care for 6 years and thankfully moved out into her own apartment just over a year ago. But let's start at the beginning, Pauline. Lovely to see you. Welcome. How did you end up in aged care?
Well, I had an incident at home and I didn't want to go back home. So I was in the hospital for a while and I said to the transitioner, the nurse at the time, please find me other accommodation. And the 2 accommodation she could find was aged care. That was my only option, was to enter into aged care. Not to my liking, but yeah.
So was that quite a shock for you at the time, that was your only real option?
It was, very much so. I thought, aged care? I'm going to join aged care? So yeah, I was very shocked, but like I said, I had no option. Wasn't given any options. So I was 44, and I thought, here I go, in aged care.
And at the time, did you get the sense that that was it? That was going to be where you were going to stay?
Exactly. Yeah. I just thought I'd end up dying in aged care, and that was it.
Pauline, well, that's where your journey started. Thankfully, it didn't finish there. But while you don't any longer live in aged care, thousands of young Australians still do. Let's hear from Andrew, who currently lives in aged care in Tasmania.
Hi, my name is Andrew. I'm 49. I live in aged care in Tasmania. For the last 4 years, I've been in a nursing home. Prior to that, I used to coach junior soccer, go fishing, all those sort of things. I've got MS and I actually had a fall, which put me in hospital for a while, and ended up going from there into aged care because there was no other place to go. For me in a nursing home, I don't really fit in with a lot of their scheduled stuff. They play a lot of bingo. That doesn't really fit into my sort of era. They do floral arrangements. They do stuff that's out there, for the older generation. One of the biggest hurdles is not living with my family. Ideally, I would like to be in a house that was suitable for myself, but suitable for my wife and kids. It just built my spirits heaps just being around my family. Being able to say good night to everyone as they were going off to bed. I'd like to just be around my wife, so if she's feeling down, just give her a cuddle, Make me feel like I'm not worthless. Living in aged care is not a real nice environment. Like, I've been in there for 4 years, and I'm going on to 50. It's not an exciting environment to be around.
So some of the challenges that Andrew has raised, just giving us an insight into what it means and what it feels like, as we heard from Pauline, to be living in aged care. As Andrew pointed out, he's not yet 50. Well, we're very privileged to have with us the WA Senator and Minister for the National Disability Insurance Scheme, or NDIS, as we all know it, Linda Reynolds. Linda, thank you so much for your time. I must say, before we even start on this, being a WA Senator, just a day after young Cleo Smith was found after such an extraordinary police operation, I imagine everyone is still sharing in that joy in WA.
Well, Beverly, good morning, and good morning to everybody who's joined this really important forum today. Yes, yesterday was an amazing day to be a West Australian. There were tears everywhere, I think, right across Western Australia. I don't think people could quite believe that so many prayers had been answered and the police, who had done such a brilliant job, were successful. So a really, really good time to be here in Western Australia. But Beverly, can I also start off by acknowledging the Whadjuk people of the Noongar Nation, from where I'm coming to this seminar today here in Western Australia. Can I also acknowledge all people who are participating today with a lived experience of a disability. So it's very, very good to be with you here today. Thank you, Beverly.
Not at all. Tell us a little about your connection to this issue of younger people living in aged care.
Well, firstly, now as the Minister for the NDIS, I've got a responsibility for about 3,200 of the 3,900 people with who are younger Australians living in aged care who currently are on the NDIS. But my connection to this came about in 2015, in fact, through the Summer Foundation as a senator. And the Summer Foundation came to visit me and explained to me the situation of younger Australians who are forced to live in aged care. And I just simply could not believe it. But of course, as we all know, it is true. So I thought someone has to do something about it, and I thought, well, that's me as a senator. So I initiated my first parliamentary inquiry into this situation in 2015. And along the way, I came to meet so many wonderful Australians who had no other choice, but as we've heard from Pauline and Andrew today, had no choice available to them. But I also met, in Geelong, I met a wonderful young lady, 2015, Kirby, who was then in residential aged care, and her amazing parents. And I could see that despite the fact that she couldn't breathe on her own, she couldn't move, I could absolutely see this amazing personality and a great spirit. And she just absolutely motivated me to make a difference. So here I am several years later, now as the Minister for the NDIS, and able to be responsible for maintaining the rage federally, if you like, but also continuing the good work that has been done by so many for so long. Because ultimately, this is not an issue that one person or one level of government on their own can fix. So I'll just leave you sort of with this about how I came into this. Is I recently met another young woman in her 40s who, due to surgery, became a quadriplegic. She lives up in the Kimberley, and she has no choice, absolutely no choice about where she lives. And I saw firsthand just how difficult it is the further you get away from capital cities in terms of getting the supports that you need, and in fact she's funded for. So I was determined before this, but I'm even more determined to really find a solution. But can I just say, Beverly, I think that one of the really important things for us to discuss here today is that we all share a passion that no person, younger Australians, should live in aged care. But I'm also equally convinced and determined that no younger Australian or no NDIS participant will be forced to do something that goes against their ability to have full choice and control over their lives.
Yeah.
So something I think we could perhaps discuss, but I think that's really important too.
And I think we will get to that during the course of the conversation. But of course, your government has put it on the agenda, but obviously with COVID and 2 very dramatic years in this country, do you feel it has lost momentum a little in terms of getting this moving forward?
Look, I actually don't think it has. I think that there is enough commitment in civil society, with organisations like the Summer Foundation and others working in this sector. There's certainly no lack of focus from government, from DSS, and also, of course, from the NDIA on this. Has there been as much public attention on this? Probably not, but there is still a lot of work happening to tackle this issue.
Let's bring in now, thanks Minister, we'll be back with you in a little while. Dr Ben Gauntlet is the Australian Disability Discrimination Commissioner. Welcome to you, Ben. Thank you so much for your time. Give us your sense of how urgently this issue needs to be resolved and whether you feel it's moving at the pace it should be.
Thanks very much for having me today, Beverly, and to our members of the audience. And I acknowledge the traditional owners of the land upon which I'm presenting, which is from Sydney, which is Gadigal land of the Eora Nation. I pay my respects to any Aboriginal and Torres Strait Island members of the audience today, and I acknowledge that we're all presenting from different lands today and also listening to this presentation from different lands in Australia. I think when we say, is this policy area moving quick enough? The answer is there's no perfect answer, because we need it to move as fast as possible. But to resolve the issue, we need to combine several policy areas to enable people with disability to exercise choice and control throughout different parts of Australia at different times in their lives that may be wholly unexpected, with different medical and health needs. And that requires that in a particular geographic location, there will be the availability of certain services at a particular time for a particular individual. And unfortunately, that model of support will take time to develop. And we need a combination of a better built environment, a better training of our allied health professionals to assess what needs people have, and then to help people to leave hospital in circumstances where they do not enter aged care. And for when people are in aged care, we need there to be some way of helping them to move into better circumstances. So we really do need the Australian disability strategy to engage with this area with very much a zeal and an intent to change the policy framework. But we also need to understand that it's not just about the availability of the service, it's also the availability of a built environment, the availability of transport. But one of the good things that has occurred is we are now openly collecting data on what is taking place. We're measuring success, and we're hopefully moving to a situation where no people go into aged care, young people go into aged care in the future, because it is a very serious human rights issue which Australia needs to resolve. Committee on the Rights of Persons with Disabilities have been very clear about this, and we need to see it for what it is, which is a very significant human rights challenge which Australia needs to.
Great, Ben. Thank you so much. Let's bring in now Jennifer Cullen. She's the Adjunct Associate Professor and the CEO of Synapse, an organisation that provides targeted research as well as specialist housing services and support for Australians impacted by brain injury and disability. Now, Jennifer, for years the number of younger people in residential aged care was stuck at that sort of 6,000 level. We are starting to see really good trends downwards. What are some of the key things that you attribute this to?
Good morning, Beverly, and good morning, everyone, and thank you for the opportunity to be here today and present. I'm a very proud Bidjara Waka Waka woman, and I come to you from a beautiful place of Yagara and Turrbal land here in Queensland. I've been involved in the younger people in residential aged care movement, I guess, for nearly 20 years. And if I sit back and reflect on some of the trends over that period of time, if I go back and talk about the older days, there was no public narrative. There was no overt discussion about younger people living in residential aged care. What we've seen over the last really 2 decades is a very big movement that has focused on young people having the voice to speak about their rights, like Ben was saying, their human rights not to live in residential aged care. And we've seen over time that has increased awareness across both the public and the private and government sectors. We've seen increasing in campaigning why it isn't right for young people to be living there. I think also there's been a change over the intersection between disability service system, between the health system, and also between the housing system. And to the Minister's point, what we've seen over that period of time has been an increase in government investment and an increase in state taking up and standing up for their responsibilities. And also we've seen overall a reduction in that silo activity between the systems. I think what has been really exciting has been seeing that younger people have also been involved in putting forward their voices of what appropriate and suitable housing would look like for them.
Great to hear from you, Jennifer, and we'll be back with you during the course of the morning, the afternoon now. In fact, we're at Deanne Davis. We know that a very large proportion of younger people who end up in nursing homes come via stay from hospital, as we heard from Pauline earlier. You work at Monash Health supporting people with a disability who are leaving hospital. What changes are you seeing at the coalface?
Thank you, Beverly. It's great to be able to speak about some of the changes that we've seen over the last 3 years since the NDIS has rolled out in our regions. And the change has really been a transformation of the options that are available for people who have housing and support needs since the NDIS rollout. There's been a huge amount of resource put into capacity building within the health service so that the health service are very able to interface with the NDIS and support our patients who have a disability and end up in hospital to navigate the NDIS system to achieve the support outcomes and the housing outcomes that they need to leave hospital. There's also been systemic changes associated with the government targets and action plan, and also the ACAS guidelines about how the systems work together and what processes support that action plan about people not entering aged care from hospital. So that's been a privilege to be a part of, actually, and we've been on this journey with a lot of our patients through the hospital system and been able to support them to leave hospital with age-appropriate accommodation and supports that meet their complex disability support needs. And whilst it's not an easy journey, it's a very long journey and a long process, which is difficult for people, young people with a disability, to live in hospital while that process occurs. The outcomes are actually life-changing for people, and it's a real privilege to see those outcomes at the end of that long journey for people. And whilst from a hospital sector, it's easy to think of that as the end of the journey. As Pauline mentioned, it's actually the start of people's journey to a new future and opportunities to live life the way they want to live their life in the future.
Right. So. Thanks, Deanne. So we are hearing lots of very positive developments and positive signs, but of course there remain a lot of younger people still in nursing homes, still facing difficulties in exiting aged care. Let's hear it again from Andrew.
Biggest obstacle is just looking at share houses at the moment, and that's not what I want. I don't want to just go into a share house. I'd really love to be living with my family, you know, like in a house environment. Ideally, just a 3-bedroom house with wider doors and, say, wheelchair accessible and tracking to the bathroom, or a ceiling hoist is basically all I would need to be able to still live with my family. That would be ideal. You know, I don't need no one to prep meals or nothing like that, because we'd be doing it as we would be doing as a family. Unfortunately, I didn't have a house that I owned to modify it. I was only in a rental property. I had to get special permission at the time when I was able to hold my own weight, just to put a handrail in the shower. One of the things that holds me back is I'm mentally able, but I'm physically unable. And I still do a lot of things with my boys where I'm the brains, they're the brawn. I'd just really like to see, you know, more houses. No one can pull a wheelchair-friendly home straight out of the sky and say, here you go. Yeah, wouldn't that be lovely?
Wouldn't it indeed be lovely? So lots of challenges remaining for Andrew and his family. Let's come back to Pauline, who's thankfully now out of aged care. But let's talk about what were the obstacles when you were trying to get out of aged care? What did you face?
Well, I had a coordinator at the time. He gave me no option whatsoever. So I got another coordinator. Her name was Nikki, and she sat down with me and said, do you know, I can get you into your own apartment in Docklands where you want. My eyes just popped out of my head and I thought, what? You can really do that? And she said, of course I can. So we just started. And I persevered, yes. It's a lot of paperwork. But like I said, I persevered. And
Pauline, how easy was it to find a new coordinator? How did you manage to navigate that?
It isn't.
Was easy.
Well, it's easy. You've got a voice, use it. So basically,
And how did you find out you had that voice though? Because somebody was telling you
Well-
that's no option.
you have to ring. I rang some housing. I spoke to Melody. She gave me an option. She said, okay, I've got a few coordinators that would be willing to take you on. And that's how it happened. I rang, spoke to someone, and it's as easy as it was, yeah.
So you found your way through to have a
Exactly.
voice within the system.
And as soon as I spoke to her, and she gave me the options, I was just overwhelmed. Yeah, I just rang Mum, sister straight away and said, oh, I can move in my own apartment. And they were positive, no negativity. You need positive people around you that's going to support you and say, go for it, Pauline, you can do it.
That's wonderful. Pauline, thank you so much. Let's now go to Lauren Lovegrove. She is an NDIS support coordinator with MND New South Wales. Lauren, what barriers do you see for younger people that find themselves stuck in aged care like we had with Pauline and Andrew still there?
Thank you. I think similarly to what Pauline and Andrew have said, one of the barriers is not knowing the system, not knowing that there are other options. And if you don't have that support team behind you, whether it's a coordinator or an allied health team, it's really hard to find out that information. So having that team is extremely important. And then hopefully, as Pauline said, finding your voice and making your wishes known can also be difficult. The other major issue, I think, is in regards to the process to apply for housing. It's very time consuming. It's difficult to navigate at times. It's not clear what process you're meant to follow, what information you're supposed to give. And again, you're relying on that team to hopefully be able to help you through that. And if it's not there, then I don't know how you would do that on your own. And I think also just the options for living. Pauline was lucky enough to get an apartment on her own. And that's what a lot of our clients would also like. I work with people with a neurodegenerative disease that can often be quite quickly changing and unfortunately does lead to death. During that time, in what's the last period of their life, they really want to be on their own and be with their family and not living in a house with someone that they've never met before who has to almost share that journey of dying with them. That's very confronting for people and very difficult.
Thank you, Lauren. Deanne, coming back to you, we're talking, of course, about wanting to get out of aged care, but where you are, to your point, you're sometimes looking at them and trying to avoid people getting into aged care. How much of a problem is that?
Over the past 3 years, I guess, since NDIS has created new options for people, but particularly since there's been much more clear guidelines and action plans around how to achieve that. I can only speak for our health service, but it really is only exceptional circumstances where residential aged care is considered for people now. There are a lot of NDIS-funded specialist disability accommodation options that are available for people with really high and complex support needs. But there's also been a lot of mainstream housing options and providers that are opening up broadly in the community where providers are willing to modify mainstream housing and people can live in mainstream housing with NDIS supports. So it really is the exceptional circumstances, but there is still a problem for some of those people with really high and complex support needs where there isn't appropriate disability accommodation or the appropriate level of funded support to enable them to not enter aged care. And those situations that we're seeing are usually for people where they might have a palliative people with disabilities who might have a palliative condition, and the timeframes associated with navigating a disability housing solution for them, it's just too long. The time involved isn't reasonable for those people. Also, I guess situations where younger people with disabilities develop early onset dementia, or people who develop dementia as their primary disability. Appropriate housing for people with really advanced dementia, that's another space that we need to address.
And Deanne, how much of an individual choice, back to what the Minister said right at the start, is it an individual choice, or sometimes is that something that is a little bit trickier with somebody, for example, developing dementia?
Definitely with the situations we've had where people have dementia, normally we're working with their families and their loved ones as well to come up with a solution that can meet their housing and support needs. The situations where people have less choice is when all of the disability options have been exhausted. They have really complex disability support needs and really complex health support needs as well, and the interface between the two services is really tricky to navigate, particularly when people might need, people with bariatric support needs might need up to 4 people to be helping them to move in bed and to transfer out of bed. So some of those really complex situations for people, we haven't quite got that tailored solution to address the very complex support needs for some of those individuals.
The complexity is where sometimes it is a lot trickier. Jennifer, are there system-wide changes that are needed or are already in train that are going to help overcome some of the obstacles that we've heard from Lauren and Deanne?
Oh, absolutely, Beverly. And I'm certainly going to come from a context in my reply around rural, regional, remote Australia, Indigenous Australians, and also from a brain injury perspective. What we see in those more isolated regional and remote communities, that there's not the level of investment into the housing designs in those regions. And obviously that's often because there is a presumption that there isn't a high volume of people. What we need to look at is a different response. That housing often in those regions, particularly for Indigenous Australians, is from an intergenerational context. There are, 1 or 2 examples in this country where architectural Indigenous-led designs and community responses have supported younger people to remain in their homes, on their country, to live, really deadly lives. So I think that's something we need to look at. My response earlier, I talked about that separation between disability, housing, and also the health system. What we really need to see for those regional communities and remote communities, a link up between the National Indigenous Australians Agency, DSS, our Indigenous Land Councils, our Aboriginal Benefit Funds, and for local communities to see how we can actually have a community-based response to those regions. I think one of the other points is in people that we provide support and help, either exit residential aged care, often don't have high physical needs from a brain injury perspective. It's more about issues of impairment associated with executive functioning, and I think we need to actually consider the housing design. My last point, Beverly, is that we still have a mentality, build the house and a person will come. We need to flip that around and say to young people living in residential aged care, what does a housing design look like for you? And then my very last point, going to both Andrew and Pauline, is that we're still having a conversation about the bricks and mortars. We need to change that and say exactly what Andrew said. We need to look at building homes, not houses, being surrounded by family and lifting spirits. That's the next part of the conversation we have to have.
Jennifer, thank you so much. And just a reminder to all of you, at the end of our panel discussion here this morning, we will be taking questions, and we have another group that will come in. We'll have an expert from the Department of Social Services, the Department of Health, and of course also the Summer Foundation. So if you have any questions of your own, please use the Zoom Q&A function to ask. We'll collate those and then bring some of those issues up that you have raised during the course of this hour a little later on. I'd like to now bring into the conversation John Kerber. He is the Summer Foundation Social Enterprise Lead. And of course, John, the Summer Foundation has been looking at this as an issue for many, many years now, probably a good 15 almost that we're coming up to. The Summer Foundation has taken the view there's got to be an evidence-based approach. What are some of the research showing you?
Yeah, well, some of the key barriers have already been raised by some of the speakers earlier today. So a lack of available accommodation and support in the young person's area is something that does come up frequently, and as other speakers have talked about, can absolutely be the case in regional locations and more remote locations. For particular styles of accommodation as well. We know there's not enough robust SDA accommodation being built in Australia at the moment, and also for certain groups, as again has been mentioned, for Aboriginal and Torres Strait Islander people, for example, there's not enough culturally appropriate accommodation and support available and being made available at the moment. But in other areas, the data shows that the markets are building that supply and building that capacity. There is stock available in a lot of areas. There is supply available. There are vacancies as well. So that one is as much a knowledge and a capacity issue of the people who are supporting people with disabilities as well. So part of the barrier is around the knowledge itself. Again, as we've already touched on, one of the other barriers or key drivers, as we've heard, one of the key pathways into aged care is through the hospital system. And that it's often that aged care can be seen as the most appropriate accommodation or support that's available where there's an urgent need. And so we're really talking about a difference in timeframes that the health system and the NDIS processes are operating on at that stage, and a shortage of age-appropriate transitional care options as well. And I think probably the third major barrier that's often being raised is younger people who are not eligible for NDIS as well. And so that's particularly where it might be a psychosocial disability, where it may be a little harder to prove that a disability is permanent and lifelong, and therefore eligibility is not a straightforward process.
Good, John, thank you very much. Let's go back to Minister Reynolds, and we do appreciate you being with us, and just hearing some of these challenges I'm sure is very helpful for you moving forward. So what do you see as the greatest opportunity that there is for the NDIS to tackle these challenges?
Well, Beverly, can I just thank all the speakers who've provided input into some of the barriers, and I think what it demonstrates is that none of this is simple or easy. It is soluble, but there is no silver bullet. And we have had great success so far, as we've heard, but we still have 3,232 younger people in aged care, and we need 3,232 separate solutions. And a number of the barriers, as we've heard, include information barriers and historical reliance on more mainstream services who are not necessarily aware of the options or really understand the requirements. Particularly, as we've heard from Pauline and Andrew, is there's a lack of transitional accommodation, particularly if people have been hospitalised. There's also a lack of social housing that is available, not just is available, it also is available to modify. And there's also a lack of houses, as we heard clearly from Andrew, in the rental market, because many people can rent, have the capacity to rent, but they can't find a house where the owner will allow them to, well, for us, the NDIA, to modify. So, there's those barriers. There's also, I think, barriers in accessing the workforce that's required for individuals, particularly the further out, as I've said, of capital cities that you get, and that's something that we're looking at separately. So there's no one solution, and there's no one level of government who can fix this. So the NDIA has established a specialist HIPRAC team, and they've expanded that team And they've got a task force now that is working to look at every single case and look at them as individuals and really work out what is the best solution and how to achieve that for everybody who is currently in aged care. And having to talk to their families and to their carers to work through those issues. They now do have a process for streamlined and facilitated access, who have not yet tested their access or eligibility for the NDIS. So we're going through and seeing whether we can't assist more in aged care to actually access the NDIA. But again, as we know, that's not a silver bullet either, because we're not responsible for all housing requirements. There seems to be an increasing impression that NDIA is responsible for all housing, but as I think it was Jennifer said, it is only for those who have really high need requirements, and we can't be responsible for all social housing for people with disability, but we can assist them on a plan to modify, their home. As Andrew said, he wants his own home, and and he needs some modifications for that. So over the next 12 months, sort of looking forwards, we'll continue to work on policies and processes and really identify where are the things that we can continue to make a difference, but again, in a way that actually meets their choice. And one of the statistics that actually surprised me is that with the current records the NDIA has, over 50% of under 45s living in residential aged care actually don't have moving out of aged care as one of their goals. And between 45 and 65, that goes up to 70%. So I think when we're talking about barriers, it is how do we work more closely in terms of what we're all doing to make sure that the participants' voice is heard and they understand what their options are and they can exercise true choice and control. But to do that, we also need to make sure that we have the right availability for a better option for them to choose to move out of residential aged care into as well. So again, it's not easy, but we are making progress. But again, we've still got a lot more work to do. So thank you, Beverly.
Thanks, Linda. Faye Minty is a CEO of Enliven Housing, an organisation that builds and manages specialist disability accommodation, or SDA. As we heard John talk about, we know that SDA is designed specifically for people who have an extreme functional impairment or very high support needs. And of course, this has become a critical part of the puzzle of helping younger people move out of aged care. Faye, in terms of supporting younger people out of aged care and into your properties, the properties that you are responsible for, what are some of the disconnects potentially?
Thank you for that. Thank you, first of all, for inviting me to be part of the conversation. It's an interesting topic that's close to my heart. The biggest issue we have is that people will identify our properties as being somewhere they might like to go. But the process from when they say, yes, that's where I want to live, to actually picking up the keys and moving in is a very slow and somewhat tortuous route for many, many people. There are so many moving parts and it's not always clear. And I think that that's the hardest part of it. There's no clear timeframes. There's nothing you can really plan exactly around. You're coordinating a number of different people's interests in it. So obviously the person with disability who's in aged care or in hospital waiting to find their new housing solution, they're sitting there waiting for an outcome, and there's no timeline that I can give somebody that says, look, in 6 weeks' time, 8 weeks' time, we'll have this solved, you'll be in before this time. We suggest timeframes, but they don't work for anybody. And I think the thing that causes me the most heartbreak is the sheer frustration of the person who is just in limbo and they don't know what to do. And then so anybody who's worked with us knows that we are a great organisation for facilitating meetings, and we do that day in, day out. So we talk to everybody and we keep people in the loop, and I'm sure everybody else is doing exactly the same thing. So I'm not saying we're unique in that space, but we coordinate with the support coordinator, we coordinate with the support provider, we coordinate with the hospitals, we coordinate with the SDA application process, and we just keep moving that process along, and sometimes it is incredibly slow. So I guess, my top things for what are the, I guess, the barriers is the time frame, the lack of clarity where I can give people confidence, and the impact that lack of knowledge, the ability to make informed decisions has on the person with disability is just tremendous. It's horrific actually to watch and to be part of, but knowing that we are going to get there, but I still can't say I'm going to get there with any definite guarantee. I can't guarantee that they're going to get the SDA outcome they want, and their heartbreak when they get an SDA outcome that implies shared housing. And for a lot of our people who have got a newly acquired disability or have I guess, experienced one that's got significantly worse in recent times and requires a different housing solution, that the idea of sharing is not something that sits easily with people, and that causes a lot of unhappiness as well. But waiting to get your SDA determination is one thing, working out how it's all going to come together and that you're going to be adequately supported, and knowing how long it's going to take, that's the I guess the process we go through. But having provided all of that information about the barriers, I do want to say being part of this system has been the most fabulous outcome when you see people move into their home, and I don't care who provides that home, if that's the right place for them and that's where they want to be, really the change in that person, the change in their outlook, the change in their attitude is just enormous. And then 6 months later, when I go back to talk to people and do a visit, the outcomes are just enormous. You know, it's
life-changing indeed.
Part of that transition is great. Yeah. So thank you.
Faye, I appreciate that. Ben, just to your point though, let's talk a little bit about the impact it has on individuals with the slowness of that process, as Faye's just pointed out.
Thanks, Beverly. I think, as Faye pointed out, one of the critical things we all need to remember in this process is we're dealing with people. People like you, like me, like everyone in the audience, like Andrew. We need to understand in dealing with people, they have families, support networks, emotions, they have feelings of angst, distress. They are not robots. And we need to be, in dealing with people, we need to understand very much that we need to ensure that people are supported appropriately to both make decisions and when they move into accommodation. In Australia at present, we need to look at universal design as a critical economic policy for the country. It is 22 times more expensive to retrofit accessibility considerations into a house than it is to build them up front. And when we consider the arguments for keeping people out of aged care, we need to remember that in the Royal Commission into Aged Care Quality and Safety, it was found that 39.2% of people living in Australian aged care facilities had experienced violence, abuse, neglect and exploitation. So there's an enormous safeguarding issue here as well. And we need to, in appreciating we're dealing with people, we need to support them, but we also need to have a very clear policy imperative of universal design. And one aspect of that is the adoption of the new mandatory accessibility considerations in the National Construction Code, which unfortunately New South Wales, South Australia and Western Australia have not taken up. And this jeopardises or can cause enormous problems for the long-term efficacy of the health system, the aged care system, the disability support system.
Yeah. Because
we need the built environment to be appropriate for going forward.
Terrific, Ben. Thank you so much. Well, as we pointed out at the start, thankfully Pauline is now in an apartment of her own. Let's take a look. I should point out that not every apartment comes looking like that. We have a little interior design aficionado to my right. She loves, she's just adored decking out your apartment. I believe you've got a parcel arriving every single day.
Calling.
You're the problem that Australia Post is lagging with all their deliveries.
No, probably.
Pauline, tell us what has been really critical other than that joy of decking out your apartment. What's made the difference for you?
It's just, I know it sounds cliche, but you can eat anything, do anything how you want, when you want. There's no limit. When you're in aged care, you're restricted. You know, you've got to eat when they eat, go to sleep when they sleep now. You know, the world gives you your oysters, so to speak. You can do everything how you want.
And you've got such a beautiful
And live in
makeup
your
table.
Look, you're in the heart of the city. You know, I'm a social butterfly. So you're always out shopping, entertaining. And when people come over, they're visiting you, not everyone in the nursing home. You've got your privacy. It's unbelievable, really. So if I can do it, anyone can do it. So like listening to Andrew, I don't see why he can't do it. He can get a home and they can modify it to his liking. Why not? Speak up.
And have the
If you don't
conversation.
speak up, no one's going to hear you.
We hear you there, Pauline, and it just looks like a beautiful place that you have at the moment. So, John, let's come back to you. Let's talk about some of these conversations, the interface between the health services and the NDIS that are going to help young people avoid aged care.
Yeah, well, certainly, I mean, having such clearly articulated government targets has been absolutely essential in galvanising resources and focus. And I think over the last couple of years, we've seen a lot of investment into new roles as well. So we've got things like health liaison officers, NDIA specialist planners, state and territory funded clinical leads as well within some of the health services, NDIS champion networks as well, all of which are working very effectively. But I think where we see the best results is where all of these specialist roles are working together with the person and their support coordinator in a collaborative and coherent framework where everybody's role and responsibility is clearly understood. And so that's where the Summer Foundation's been doing a lot of work over the last couple of years as well, through things like developing our collaborative discharge approach, which was developed with a number of hospitals throughout Australia, which is really a best practice framework and toolkit for the managing that interface between health and the NDIS. And also our housing brokerage service that we operate as well, which works directly with people who have become stuck in hospital and their health and support teams to really embed that best practice collaborative approach and to show people what's possible and to bust some of those myths around what really is achievable for people, as we've heard today. Yeah.
And how do you break down some of those issues? You say there is stock, but there's not necessarily the match. How can you work around some of those issues so the match-up is there?
Yeah, well, I mean, the process that we take within the housing brokerage service is starting with a conversation with the person and with their support team around understanding what their housing needs and preferences are. So that's what their support needs are, what their functional needs are, as well as where they want to live, who they want to live with, whether they want to live on their own or with other people as well, which was equally important and is one of the fundamental tenets of the NDIS that's perhaps forgotten sometimes is that everybody should be empowered to take reasonable risks in exercising choice and control in their own lives as well. And so that's really the heart of the process is understanding the needs and preferences of the individual and then undertaking that search to find accommodation that matches that.
Minister, coming back to you, is there any merit in actually legislating against younger people going into aged care?
Look, Beverly, that's a good question, and it has been raised with me. In short, my answer is no, because when you think about all of the barriers that have been raised here today, I don't think legislation will fix a single one of them. And what has worked so far is actually tackling the problem in the ways that we've discussed today. And we need to keep working together, person by person. So those who already have a goal to move out, how do we work with them? The NDIA is a solution for many, but not all. So if the NDIA is not the solution, then what is for accommodation and for other community-based supports? And what role then does organisations like the Summer Foundation and others have to play? So I think that legislation won't assist, but keep doing what we're doing, keep reviewing what's working, doing more of what's working, and, you know, as has been said, is keep wrapping services around individuals and provide them with the options for whether it's accommodation and SIL provided by the NDIA, whether it's helping them find their own rental property, whether it's helping them find with states and territories social housing, and how do we do that to exercise their choice and control. And I think the other thing that legislation won't help with is for those participants and non-participants in aged care who don't yet have moving out a goal, and working with them to really understand why that is, and how we can work with them to either make it better for them where they currently are, make sure that they're getting the support services they need, but also working with them to present other options that might meet their needs so that they are then in a position to exercise true choice and control. Yep. If we can provide them and they can see and believe they have an option that meets their needs in a better way. So I don't think legislation will deal with any of those issues. So
no, understandably.
No, from my perspective.
Thanks for that, Minister. Lauren, you know, we heard Pauline say it was as simple as just getting a new support coordinator to make that change for her. But what sort of skill, knowledge, I mean, obviously every case is different. What skills and knowledge and resources do you think we need to make sure young people have?
I think we need to make sure that they're aware of what the options are. So you need people in the industry who are on top of that and can present that in a way that works for that person, because each person is different. They take in information differently. We need to be skilled in giving them that information in a way that works for them. And I think encourage them to be their own advocates where possible, or for the family to advocate on their behalf where possible. So that, you know, they can find a new coordinator, or they can find a new allied health team that can assist them, linking them up with organisations like Summer Foundation who can also help point them in the right direction. I think knowledge is a big part of how we could improve things for people.
Yeah. Faye, you've talked of some of the successes, but you've also talked of how slow the system can be sometimes. What do you see as your hopes? How do you see it reaching this connect of SDAs to the people who need these homes? How does it reach its full potential?
I think support coordinators knowing what the options are and having the time to actually be educated on what those options are, and getting adequate funding. I think for often it just becomes like it's too hard and there's not enough time, and there's a lot of pressure on people to help people move out of hospital. Support coordinators like Lauren are the key to this entire experience, and I can assure you when they're good, like Lauren, it makes a huge difference. So knowing what's available, being able to support people to do it, and having adequate time and funding to support people at their own pace to come to their own conclusion as to what's right for them.
Thanks, Faye. Minister, you've heard a lot of sort of from the coalface today. What does the NDIS have in train? What are your takeaways, do you think? What are you going to give your people to work on after today's discussion?
Well, Beverly, they're already, as I've said, they're already doing a lot, but I think I'm even more convinced that they're on the right track. In terms of working with states and territories, working with hospitals, and working with organisations such as Summer Foundation and others to find solutions. But I think having now an approach person by person and reviewing every single participant is, I think, a really important next step, because that will then mean we will have a better idea of where the solutions do lie with the NDIA in terms of support and how we can speed that up or do something differently. But I think it's also just as important so that we can identify sort of by state and by area who actually either wants to find their own home, a rental home, or need a transition accommodation, or need a state and territory social housing option, and that we can work with them to do that. So I think more of the same is probably, well, more of the same, but also more of what's working.
Yeah, and really understanding what is working and trying to translate, to your point about those numbers, they're quite surprising, and it would seem as if sometimes the conversations, maybe the options aren't on the table for people.
Well, I think you're right, and that's certainly come out from this discussion today. And I think we've got to be very careful. I've talked quite a lot about choice and control, but I think we've got to be very careful with our good intentions, that we don't end up denying people choice and control, and that we assume we know what's best for them, but that we move at their pace. But as you said, it's actually, as a number of people have said, is talking to people, making sure that we hear their voices heard, as Pauline has so powerfully said, and that we are not presuming we know what's best for them, that we can work out what they want and how we might go about providing that. Is that through the NDIS? Is that through states and territories? Is that through community-based support? Is that working with people who, the rental market, and actually, helping people with landlords, for example, and providing that stock? And I think, Commissioner Gauntlet makes an incredibly powerful point, several today, but particularly on housing and building codes. So there is a lot of work happening between states and territories on building codes, but I don't think they've quite cracked it yet, so that builders are required to, when they build something, make, as Andrew needs, he needs wider doors, so that it's much easier to adapt when necessary. So we've got a long way to go, but we've come a long way too.
Minister Reynolds, we appreciate the time that you have given us, and obviously listening and taking on board so many of these points, and of course to all of our speakers and contributors today. It's been just a really powerful conversation, and really highlighted some of the key issues. We should leave the last word to where we started, Pauline. You are clearly living such a different life. What is your advice? What would you be saying to people? What are the key things to remember?
Get the right coordinator. You need the right support coordinator. That's number one. Then you must persevere, be persistent, speak up. Speak up, because it can happen, and it will happen. I mean, I'm a living proof. If I can do it, anyone can do it. So you've got to speak up. Have the right people behind you. Positive, no negative energy. But get the right support coordinator, and things will go your way.
Terrific, great advice. Pauline, so lovely to have you with us. Thanks to our other guests in the studio as well. But just a reminder too that we are going to be taking a short break, but we have been receiving your questions, and we will be coming back very shortly with a panel to put your questions to them and kind of wrap up some of the finer points. But for the moment, thank you so much for your company. Thanks so much to all our wonderful speakers who have contributed today. All the best. Thank you so much for your time. We'll see you soon. And lovely to be back with you for this final part of our Summer Foundation presentation. Some questions from some of our expert panellists. And we have with us Luke Mansfield, who is Deputy Secretary Disability and Carers at the Department of Social Services. Deb Cannock, Branch Manager of Mainstream Interface and Royal Commissions at the National Disability Insurance Agency. Eliza Strapp, who's the First Assistant Secretary, Market and Workforce Division, Ageing and Aged Care Group at the Federal Department of Health. Linda Hughes, who is the Upskill Lead at the Summer Foundation, and Melody Carbons, who is National Tenancy Matching Manager at the Summer Foundation. So thanks to all of you for being with us. Let's start with Eliza, a topic on aged care. Is aged care, Eliza, seeing any changes in the number of characteristics of young people being referred to and entering aged care?
Yes, thanks. Great question. I think Minister Reynolds talked about earlier that we've seen, since the strategy began, we've seen a 62% decrease in people entering residential aged care, which is great, but we've still got a way to go. We've still got over 3,000 people in residential aged care. We are still seeing people enter every month. I think some of this is to do with people needing respite and not having tested their eligibility for the NDIS yet, or not having had access to social housing, and also needing a way to get out of hospital. Where we've just started a program where we've funded Ability First as a system coordinators to work really closely with those people who are might be in hospital or are at risk of entering residential aged care, who are not NDIS or might need to test their NDIS eligibility, to work with them around alternatives so we can keep them out of residential aged care. We know that once they go in, it's really, really hard to get them out. So our big focus is trying to prevent them from entering. And we're hoping that this extra boost of support is going to make a big difference, and also link really closely in with the work that the NDIA is doing.
Thanks, Eliza. Let's go to Deb, a question on the NDIA. I have found a large barrier to accessing SDA and therefore having to look at aged care are the health and nursing needs of people who require round-the-clock registered nursing support and provision of certain medications, who have been told that they cannot access this through funded supports. What plans does the NDI have in place to overcome this?
Thanks very much. Hi, everybody. Look, that's a really complex question. I think we would all on this call understand that people have complex needs, and some of those are very much disability related in terms of someone's functional capacity as a result of their disability. And some people also have very complex medical support needs. So there are agreements in place between governments and the health system and the NDIS that sort of delineate some of those matters. Disability support workers may not be qualified to administer certain medications because of the clinical governance arrangements that are required for that. So in those instances, there's certainly absolutely the opportunity for those support systems and supports to work collaboratively hand in hand, so that there would be potentially some NDIS funding and some supports provided by the health system. And I think to Minister Reynolds' point earlier, there's no one path for everyone. It is a combination of housing, health services, disability supports, and all the other sort of parts of an ecosystem that better support someone. So it's never really either or. It generally needs to be a bit of everything, and we all need to be working together to make sure that every individual, we fully understand the whole suite of their needs, and each system then leans in to do the bit that they're responsible for,
but there's
for the benefit.
There's a good possibility, though, that there will definitely be people who fall through the cracks.
Well, one would hope not. I think it is an evolution, and we know that the complexities of people who perhaps acquire a disability. They've never had to deal with any of these sort of systems before, and so some of the things that we've put in place with our colleagues in the Department of Social Services, Department of Health, and with states and territories, by increasing the number of NDIS staff and, to Eliza's point, the system coordinators, is to ensure we know who's there as early as possible. And there are many avenues that we would hope that people would be able to, the pathways in to each system, so that we work across the top. So
Yep.
There shouldn't be people falling through the gap, and we would want to know about it if that's the case.
Thanks, Deb. Melody, a question for you on housing issues. We've heard, of course, about some of the barriers during the course of this session. What specific cohort of young people do you think are going to be the hardest to get out of aged care by 2025?
Yeah, I do think it's those with the most complex needs. So people with potentially complex behaviours, people with dementia, Parkinson's, and who require very high level of support. So potentially 24/7 line of sight support. And the other group to consider are people that have a real lack of supporters around them. So people that don't have a lot of family, people that don't have guardians, or like distant guardians, and really who aren't getting that constant provision of information provided to them to make informed decisions.
Thanks for that. Luke, let's come to you on a question that is really fascinating. We heard a fair bit of discussion around once, of course, people are injured, they end up in hospital. Why does the discussion around what sort of housing they are going to need start a lot sooner than necessarily just at discharge, where it may become a little bit complicated? What are your thoughts around that?
Thanks, Beverly. I think that that's a really good question, and I think that in terms of the work that we need to continue to do going forward, working with the states and territories, is to help educate hospitals around what they can do to intervene early with participants or people with disability in hospital, to feed through that information through to the NDIA in particular, but also to their own housing areas within states and territory systems, so that there can be a better understanding earlier in the process what a person's individual needs are, and so that can be explored, because as everyone would appreciate, if there's a need for new housing or significant modifications of a home, or for people to be waiting on social housing waiting lists, then that can take some time. So the earlier that that information does flow from the hospital through to other systems, housing systems, and the NDIA, the earlier that action can be put in place to make that transition smoother.
Thanks, Luke. Linda, a question to you on support coordinators, and we heard a lot of discussion about support coordinators, and particularly from Pauline, who said that really made a huge difference. Now, participants seem to be, this question is under the mistaken belief that simply getting a support coordinator will simply solve their housing problems, but many coordinators are not necessarily experienced in that area. What's been done to try and address that problem and equip all support coordinators with that knowledge?
Yeah, that's a really good question. I think that one of the things that we see is that, you're right, that there's a big variety in skills and experience that support coordinators have. We provide, at Upskill, we provide professional development for support coordinators, really recognising that they play a really vital role in ensuring or supporting people to live well in the community, particularly people with complex support needs. We think that by having a look at our resources and having a look at what we offer would really help point people in the right direction, as well as the Summer Foundation resources. We've also created a resource recently for participants in choosing a support coordinator, and it really starts to sort of unpack those questions that you could ask a support coordinator before you engage them, to see that they've got the right skill set that you're looking for. support coordinators can have a variety of great skills in one area, and perhaps in another area they don't have those skills. So really choosing the right person. If you've got a housing goal, you need a support coordinator who has some runs on the board, who has some experience, and who knows where to find information on supporting a person to leave hospital, leave RAC, who has experience in negotiating those mainstream interfaces that Deb talked about. This is complicated stuff, and if you're asking another system to lean in and play their part, you need to know which system to ask. So we'd really recommend that you're working with support coordinators who have that kind of knowledge to help address that complexity and those barriers that you might face leaving residential aged care or hospital.
Linda, thanks for that. So it's really getting the right match is what you're saying. Another question for Deb on NDIA. Many people with disability have to share a house, and that came up again quite a few times. Other than the fact that people might want to share houses, why does it have to happen that in some instances you do need to pair people up together?
It's a really good and complex question. I'm not a delegate or a decision maker in terms of a plan funding, but what I'll do is I'll give you sort of an overview. Essentially, it comes down to an NDIS delegate or a planner is required to make what's called a reasonable and necessary decision under the NDIS Act. And there are various matters that need to be considered in making that decision. So obviously the person's needs, and they'll be informed by evidence often from occupational therapists and specialists and others. And then there's other considerations that go to what is the best outcome. And the other part for the scheme, as you will always also be aware, is that the scheme has to be sustainable. So as you know, I guess with responsibility for the spending of taxpayers' funds, we have to also make decisions, and it's outlined in the Act, that also have a value for money component. So we do know that there are absolutely individuals who want to live alone, the same as, I might choose to do, or you might choose to do. And there are also other people who, people without a disability who also share. So it is a fine balance of what the person's needs and wants are. Often it's determined by location of what's available in a certain area, but a reasonable and necessary decision is made, and that sometimes might mean that someone's found eligible, if they're eligible for SDA, bearing in mind that that's actually a small number of NDIS participants, and it might be that they're found eligible for a particular dwelling type with the particular category, design category, and it also might be then that they have funding that allows, might be a 2-bedroom or a 3-bedroom 2-person share. So then the person can go looking for an opportunity for a dwelling, an available SDA dwelling that fits that design and funding category.
Thanks, Deb. And a final question to Luke on advocacy. YPI-RAC may be in need of advocacy support to ensure their access to support so that they can exit into more suitable housing. How can the government and the sector make sure that this group have the essential support needed?
Thanks, Beverly. So I think that there are a range of ways that people can get support to exercise their choice and control and to have their voice heard. Of course, in the context of Waipuric, many unpaid carers, family members, others support people in that process. Also, the system coordinators that Eliza referred to earlier that have been established by the Department of Health can help play a role in understanding the individual's needs and what their preferences might be. And also the Australian government and some state and territory governments fund independent advocacy services to help people with disability to exercise their choice and control. So there are a number of different avenues that people can access, and this is something that will continue to work with the disability community around, as well as people who are supporting younger people in residential aged care about.
Luke, thank you. And thanks to all our participants in this, taking some of these questions as we wrap up Summer Foundation Forum for the year. Just a note to let you know that the Foundation team is keeping track of all questions that were asked during the forum, and will get a comprehensive Q&A document up on their website as soon as humanly possible. So thanks again to all of you for joining us. It really has been a terrific session, a terrific discussion, lots of work still yet to be done. And it's been terrific once again to be with you. Time now just to hand back to Paul to wrap up. Paul.
And thank you so much, Beverly. Once again, you've coordinated and facilitated an enthralling discussion. So thank you for your time. On behalf of Summer Foundation, sincere thanks to everyone who participated and joined us today. Special thanks to both our forum speakers and our Q&A panellists for sharing their experience, insights and knowledge with us. We encourage everyone to keep the conversation going. So we will have a video of today's forum on our website and a Q&A resource document up very shortly. In the meantime, please share your comments, feedback, suggestions via our social media channels. So please use hashtag YPIRAC. A quick reminder that our website's also a great place for useful resources for people with disability, as well as health, disability and aged care professionals. So that concludes the annual forum for this year. Thanks everyone for your interest and your attendance, and stay safe. Thank you.